This video provides general information about third molar or wisdom tooth extraction surgery, including some of the risks, benefits, and alternatives to surgery. We are providing this information to assist in your decision whether or not to proceed with this surgery. Please note that not all of this information applies to every patient. For specific information about your diagnosis, treatment options, surgery, and recovery, be sure to ask your oral and maxillofacial surgeon. This video will cover why wisdom teeth are extracted, how to prepare for your surgery, risks associated with wisdom tooth extraction, pain management options, and what to expect following surgery, including at-home care. Third molars, or wisdom teeth, develop and grow in the very back part of both the upper and lower jaws. A high percentage of wisdom teeth remain impacted, meaning they can't reach their expected functional position and remain deep in the bone or only partially erupted. Impacted wisdom teeth can become angled or turned in directions that can cause damage to other teeth or parts of the jaw. This may lead to tooth crowding, infection, and possible tooth loss. For some patients, wisdom teeth can be left in place with little risk of future trouble. For other patients, impacted wisdom teeth will need to be removed to prevent damage to the neighboring teeth and bone. The recommendation to have your wisdom teeth removed typically comes from your general dentist, orthodontist, or other dental professional who work as part of the team, including you as the patient and your surgeon, to design a treatment plan that meets your needs. Your care team will provide you with specific instructions to help you prepare for surgery. A few common instructions include if you should take your regularly prescribed medications, the time to arrive for surgery, how long your surgery will take, and your discharge plans. Depending on the type of anesthesia you and your surgeon have decided on, you may be instructed not to eat or drink for at least 6 hours prior to surgery. Each patient's treatment plan is unique, so be sure to ask your care team about how to prepare for your surgery. While all surgery carries risk, your surgeon will try to prevent, minimize, and control these risks. Nonetheless, it is important for you to understand these risks before your surgery. Your surgeon cannot guarantee the results of the procedure, and the length of time needed to complete treatment may vary for each patient. With wisdom tooth surgery, you may experience pain, swelling, bleeding, temporary bruising, soreness or cracking at the corners of the mouth, tissue scarring, damage to your lips, jaw, and teeth, including existing dental work, stress or damage to the jaw joint, or in rare cases, a jaw fracture. Infection can happen with any surgery and is often treated with antibiotics. However, some infections may require prolonged treatment, additional surgeries, or in rare cases, hospitalization. There are several nerves in your face, including those in your upper and lower jaws. Dental extractions, or the use of local anesthesia, can cause injury to these nerves. These nerve injuries can result in altered or loss of sensation, including loss of taste or numbness. Nerve injuries can also cause pain or altered feeling in the face, cheeks, lips, chin, teeth, gums, and/or tongue. Nerve changes after surgery may resolve over time, but in some cases, the changes may be permanent. Additional risks with third molar extraction include sharp edges or bone splinters where the tooth was removed, an opening from the mouth into the sinus cavities, or tooth roots left in place. Some of these complications may require additional surgery. Some patients may develop a dry socket about 4 days after surgery. A dry socket occurs when the blood clot at the extraction site, or socket, dissolves early or does not adequately form, resulting in uncontrolled or persistent pain deep in the jaw. Your surgeon can treat a dry socket to relieve pain, but the extraction site may be slower to heal, and additional post-operative visits may be required. Your surgeon will discuss with you the available options to control your pain and anxiety during and after surgery. During surgery, local anesthesia is used to numb the surgical site. The numbness from local anesthesia can last for a few hours after surgery and allows most patients the time needed to get home and start taking their pain medication before the numbness wears off. In addition to local anesthesia, you may be a candidate for other anesthesia options. IV sedation or general anesthesia may cause some patients to experience disorientation, drowsiness, nausea, vomiting, or allergic reactions. As with any anesthetic, whether performed in a hospital or an outpatient setting, these risks can be serious and in rare cases may even be fatal. After surgery, many patients effectively control their pain with over-the-counter pain relievers, such as acetaminophen, also known as Tylenol, or ibuprofen, also known as Advil and Motrin. Some patients may require stronger prescription medications like narcotics or opioids to help relieve moderate to severe post-surgical pain. Be sure to discuss your pain control options with your surgeon. For patients that receive IV sedation or general anesthesia, please be aware that these medications can have a different effect on each patient. Some patients may have lingering anesthesia effects, including memory and coordination issues, for an extended time, possibly into the day after surgery. Because your doctor cannot predict how you will react to IV sedation or general anesthesia, an escort must accompany you to the office, remain in the office during surgery, drive you home, and stay with you after surgery until the effects of anesthesia are no longer present. This is typically 4 to 8 hours after discharge from the office. It's important to understand that an escort is a responsible adult who can assist you after surgery until you are sufficiently recovered from the effects of anesthesia. You and your escort will receive instructions for home care and follow-up. Please be aware that if your escort is not available on the day of surgery, the surgery may be delayed, rescheduled, or completed with local anesthesia only. Once home, it is important for you to rest and follow the home care instructions. If you experience more than moderate discomfort, excessive bleeding, or have any post-procedure questions, you or your escort should call your care team for additional consultation and directions. For most patients, their diet for the first few days after surgery consists of soft foods that require little to no chewing. You may receive more specific diet instructions from your surgeon depending upon your specific surgery. This video provided a general understanding about wisdom tooth extraction to assist in your decision whether or not to proceed with treatment. Each patient and their treatment plan are unique. Please consult your oral surgeon if you would like further explanation about any information in this video, or if you have questions about your specific treatment plan or topics that may not have been included in this video.